So let me ask the panelists and the keynote speaker to the podium, and we are almost there to start the afternoon session, which is focusing on how we are delivering health services and how we are transforming the health systems, also at the time of crisis and the war. And today's afternoon session, we have keynote speaker, and we are very thankful for Viktor Leshko for joining us. And it is always a long way from Kiev, but he made it to Tallinn, so thank you. And he will tell us today not only about what has happened since 24th of February, but he has been Minister of Health already since May 2021. Before, he was also Chief Medical Officer and the first Deputy Minister leading the COVID response, but he has been working in public health almost 2 decades. So we have a keynote speech which looks how we transform the health systems in these various conditions, and we have learned that also yesterday. We have heard about Ukraine transformation, the trust throughout almost 2 days. So we hear from Viktor, and we have also 4 panelists who are coming from different sides of Europe. We have ministers, we have colleagues from Ministry of Health, we have academia, we have a European Union. And the idea is to reflect after Viktor's presentation a little bit on trust and transformation, which is the key of the conference now in Tallinn, 15 years since we signed the Tallinn Charter in 2008. It was a rainy day, I remember that time. Now it's a snowy day. It's a different venue. A lot of people have changed, but our commitment to transformation, the health system, and its complexity has stayed, as we have heard also from measurement this morning to other aspects. But before we go to the presentation, we have prepared also the small video to give a little bit of the reality check, what is happening currently in Ukraine. And I would like to ask the organizers to show the video, and after video, we will hear from Viktor.
Чугуев был обрезан, то есть войска наступали, мало осталось медиков. Из 800 человек в больнице, осталось там меньше 300. Люди, которые там много лет не работая, приходили, оставшись здесь, приходили в больницу и как-то вот вновь формировались отделения. С амбулаторной службы приходили сотрудники, некоторые там даже еще там слабо даже владели, не все могли инъекции внутривенные делать, учились, в частности там и жили в больнице, и оказывали помощь.
Молодці, спасибо і вам, і спасибо врачам, що нас підтримують уже як-не-як вже 80 років. Тож, хороші в нас врачі, дуже хороші. В будь-яке время скажеш, і попросиш, і прибіжиш, і вони все внимання обращають.
У нас 12-го влучила біля нашого будинку ракета. Я знаходилась в будинку, і Людмила Володимирівна приходила до нас і до сусідки, вона допомагала нам.
Вона була всю окупацію тут. І вона їздила по домах на велосипеді. Під бомбіжки я приймала роди у березні місяці тут, у погребі свого дому. із сусідкою медсестрою. Не мати нічого вдома, крім миски з кип'яченою водою, як то кажуть, так? І трубочки фонендоскопу. Я розумію, що то подвиг.
З початком великомасштабного вторгнення наше життя повернулося майже на 360 градусів. Госпіталізовані люди були з травматичними ампутаціями, відкритими ранами живота. По спеціалізації я хірург загального профілю. Враховуючи наявність таких хворих, потрібно було здобувати ще одну освіту, ще одну спеціалізацію.
Наш заклад приймав участь у гранті пацієнтоорієнтованості. Зі сторони пацієнта, заходячи у наш заклад, можна сказати, що все чітко, все доступно, все зручно, як у обслуговуванні, як у запису до лікаря.
Ми є переселенцями з міста Дебальцеве Донецької області. Не тільки для нашої сім'ї, для всіх покращилося. Все доступно, все в телефонному режимі. Навіть здається, що і лікарі якісь більш уважні. 5 зірок просто.
Такий яскравий приклад – це була виявлена дитина, підліток, які були замислення про суїцид. І ми дуже, як кажуть, вчасно втрутились в цю історію. І зараз про це дитина не думає. Це таки наша перемога.
И когда люди боятся, бегут, закрывают магазины, аптеки и все прочее, а медработник остается на рабочем месте. И как бы ему ни было страшно, он все равно принимает людей, и ему приходится не бороться со страхом, а бороться с жизнью людей.
And now I would like to give a word to Victor, who I introduced before, to tell us about the story of transformation that took very fast start in 2017. And then it has taken many turns, but I always admire the courage of Ukrainians and the ministry and the minister to lead the changes in the most difficult times. Victor, over to you. And Victor will speak in Ukrainian, and those who need interpretation, you can use the channel 1. Thank you. Please, Victor.
Einen Moment. На цьому тижні компанія Google оприлюднила результати того, що українці забували в пошукову систему найчастіше впродовж 2023 року. На першому місці була карта повітряних тривог. На другому місці графік відключення електроенергії. Покупка року в пошуковій системі. На першому місці препарат калій-йодид, який використовується для профілактики ураження щитовидної залози при радіаційних аваріях. На другому місці генератор, який дозволяє запустити будь-яку систему, як є альтернативне джерело електропостачання. Чому я навів ці дані? Тому що ми з вами будемо говорити про трансформації систем охорони здоров'я. І коли як міністр країни, яка воює, захищаючи територіальну цілісність і демократичні цінності, не можу не говорити про трансформацію системи, не бачачи, в яких викликах існує сама система. Якщо ви подивитесь на ці цифри, коли відбувається трансформація системи охорони здоров'я в Україні, ви побачите, що 2 із них – це період повномасштабного вторгнення Росії на територію України. Ще 2 роки – це пандемія ковід. Тобто трансформація запустилась в надскладні умови. Але цифри 24 лютого 2022 року змінили майже все, що можна було змінити у функціонуванні нашої країни. Проте ми не зупинились, ми продовжили боротьбу і ми продовжили реформи. Я не буду зараз називати ці цифри, які ви бачите на слайді. Я вам назву тільки одну цифру. 82 дні. Що значить ця цифра для мене? 24 лютого о майже 5 ранку я проснувся у квартирі в містечку, в якому я живу, на 9-му поверсі, від вибухів, які пролинали десь кілометрів за 5 у військовій частині, яка від мого будинку. Я одягнув костюм, взяв з собою 3 білих сорочки, обійняв дружину і обійняв доньку, якій на той момент було 16 років. 82 дні я не бачив своєї квартири, 82 дні я не бачив ні дружину, ні доньку. Я не знав, чи я зможу її побачити. Мені поталонило. Я побачив і свою квартиру, я побачив і свою доньку, і свою дружину. Але велика кількість українців, яка 24.02 залишила межі своїх будівель, часто не бачили ще ні своїх рідних і вже не можуть побачити своїх будівель. І завдяки тому, що є ви, завдяки тому, що весь світ став на підтримку Україні, підставив плече, Україна існує і 13 грудня 2023 року. І я маю надію, що це дозволить нам існувати і в подальшому. Я вдячний всім міжнародним партнерам, представникам всіх урядів і простим громадянам, що ви допомагаєте Україні рухатись вперед. На цьому слайді ви бачите тільки перелік тих країн і кількості тих пацієнтів, які по системі МедЕВАК направляються на лікування травм і онкології в клініки, які існують сьогодні у вас. Я окремо подякую уряду Норвегії за те, що допоміг нам з автобусами реанімаційними, які дозволяють по території країни вести пацієнтів до хабу, який знаходиться в Польщі, в Жешові, і звідти, знову ж таки, переобладнаними літаками. Спочатку це Німеччини, після цього уряд Норвегії переобладнав, і ми розвозимо реанімаційних хворих по всіх країнах Європейського Союзу. В подальшому це, знову ж таки, програми Європейського Союзу, програми, які підтримуються Всесвітньою організацією охорони здоров'я, дозволяють лікувати і повертати українців назад. Сьогодні та кількість лікарських засобів, медичних виробів, яка приходить в Україну від міжнародних партнерів, обраховується вже сотнями тисяч, десятками тисяч тонн. Це допомагає нам відновлювати заклади охорони здоров'я, які були пошкоджені. І сьогодні в 3 години ночі, поки я поселявся в готелі в Талліні, була чергова атака на місто Київ, ракетна, 10 ракет, і одна із них збита системами протиповітряної оборони, потрапила в дитячу лікарню у місті Києві. Вона не принесла тих руйнувань, які могла б принести, якби попала не збита, але знову ж вікна вибиті, лікарня виведена з ладу. Це буде потребувати декілька тижнів для того, щоб ми перезапустили її, і вона знову розпочала приймати маленьких пацієнтів. І ми не розуміємо, скільки ще. Але ми розуміємо, з якими проблемами нам приходиться під час війни зіштовхатись і реагувати на них, і при цьому трансформувати систему для того, щоб вона якомога ефективніше в цих умовах могла функціонувати. Не просто функціонувати, а якомога ефективніше функціонувати. У нас немає ні часу, ні можливостей нераціонально використовувати обмежені ресурси, які є в системі. І знову ж таки, завдяки тому, що проходять такі конференції, що ми можемо говорити і виявляти ці проблеми, ми можемо рухатись вперед із перспективою дивитись в майбутнє. І ми рухаємось вперед. Ми під час війни, уже під час війни, запустили величезну кількість змін, які сьогодні нам приносять уже результат. Ми розширили програми реімбурсації лікарських засобів. Стараємося зараз довести цю програму у найбільш віддалені населені пункти, оскільки з початком війни значно погіршилась логістика всередині країни. У нас не було пального декілька місяців. У нас було порушено міжміське сполучення. Із сільського населеного пункту в місто доїхати неможливо. А саме там концентрувались і аптечні заклади, і заклади охорони здоров'я, які надавали медичну допомогу. Але розуміючи, який ризик нам несе антибіотикорезистентність, особливо це зараз актуально під час воєнного стану, коли пацієнт проходить декілька маршрутів, етапів евакуації через лікарні, в яких дотриматись питання інфекційного контролю нереалістично в військовий час. Ми розуміємо, з якою резистентністю ми зустрічаємося на кінцевому етапі. І багато хто з європейських клінік, також які приймають пацієнтів, щоб приїхали до них з поля бою, також розуміють, з якою проблемою вони стикаються. Тому ми навіть під час війни запустили електронний рецепт на відпуск антибіотиків. І виключно після виписки лікаря в електронному режимі людина може в аптеці купити лікарський засіб. Зберігання крові, її постачання і крові компонентів – це черговий виклик. Ми запустили чергову інформаційну систему і розуміємо, де сьогодні кожен літра крові або її компонентів знаходиться, як її забрати в більш безпечному регіоні і доставити на лінію фронту. Ми запустили натовські стандарти, коли дозволяємо переливати кров сьогодні бойовим медикам, які не є з освітою медичною, але які пройшли відповідне навчання. І сьогодні перша група крові, як мінус, так і плюс, є базовою для нас і користується величезною популярністю, тому що велика кількість цієї крові та її компонентів знаходиться на передовій. Паралельно з цим проводиться трансплантація органів. За період війни, 22-23 рік, ми зробили більшу кількість органних трансплантацій, ніж за цей період довоєнний, з часів незалежності нашої країни, з 1991 року. Це унікальні речі, які показали, що ми не зупинили трансплантацію, ми її вивели на зовсім інший якісний рівень. В нас навіть під час війни вперше пересаджували серце легені. У нас вперше співпав донор-реципієнт для пересадки кісткового мозку, і український донор, і український реципієнт. Ми продовжуємо розривати програму медичних гарантій, і я дякую знову ж таки міжнародним партнерам, завдяки яким підтримкам коштів і американських платників податку, і коштів Європейської комісії. Це та програма, це ті кошти, які дозволяють програмі бути і програмі розвиватись. моніторинг якості надання медичної допомоги. Під час військового стану це одна із актуальних питань, оскільки кількість так званих турнікетних синдромів зростає, які тягнуть за собою велику кількість ампутацій. Це як один із прикладів. В довоєнний період в країні було десь близько 27 тисяч ампутацій на рік. Зараз у воєнний період ми маємо 90 тисяч ампутацій на рік. Це цифри, які виросли на порядки. Це тягне за собою протезування, тягне за собою реабілітацію, тому якість в тому, щоб зберегти кінцівку, один з для нас пріоритетів, і ми працюємо по цих напрямках з усіма можливими партнерами. Але те, що ми маємо сьогодні як ключові пріоритети. Реагування на виклики, які приносить нам війна. Після цього маємо 3 блоки, через які ми проводимо будь-яке рішення, яке приймається на рівні міністерства або уряду нашої країни. Як це впливає на доступність медичної допомоги, на якість і безоплатність для пацієнта. В подальшому наступний пріоритет – це ветерани, люди, які повертаються з бойових дій. І реагуючи на їхні потреби, ми забезпечуємо вирішення цієї проблеми шляхом забезпечення універсального доступу до цих послуг і всіх інших громадян нашої країни. І наступне питання – це людський капітал, людський ресурс. Без людського ресурсу будь-яка система не зможе забезпечити ефективність. І для нас збереження людського капіталу, людського ресурсу, людського життя є топ-темою і топ-пріоритетом. Ми в умовах воєнного стану провели госпітальне планування, визначили ключові 157 лікарень в країні, в які найбільші інвестиції, найбільші ресурси направляємо. Це багатопрофільні лікарні, які зможуть закрити всі види медичної допомоги. Це для нас топ-лікарні, які під час війни повинні забезпечити функціонування. На їхній базі ми розгортаємо ще і реабілітаційні відділення, які можуть справитися з тією кількістю пацієнтів, яку нам генерує воєнний стан. І це завдяки, знову ж таки, спільній співпраці з Всесвітньою організацією охорони здоров'я. За останні 2 роки ми зробили міні-революцію в реабілітаційних послугах в нашій країні. До воєнному періоді ми не могли сказати, що можемо забезпечити таку кількість одночасних реабілітаційних сеансів, які можемо забезпечити їх у грудні 2023 року. І ключова фраза, яку б я хотів сказати, що Росія не країна-терорист. І якщо думає хтось, що щось зміниться, не само по собі, так не відбудеться. Тому ми наголошуємо, що тримаючись разом, ми вистоїмо, а якщо будемо триматись осторонь, загинемо кожен поодинці. Наше прохання – триматись разом і допомагати Україні. А українці доказали, що наша стійкість і наш героїзм – це може бути тим форпостом, який не дозволить поширитись проблемі за межі наших кордонів. Дякую вам за увагу.
Thank you, Victor. And I think we have got a good overview of what's happening in Ukraine. We have seen also how the transformation is possible at the time of war, and it builds also on the previous transformations. But before we go to the questions from all of you, we hope you have few. We have worked hard to generate some ideas, but we have also 4 great panelists to hear their reflections. And I would like to start from Rina, who is Minister She is a Minister of Health now in Estonia. We have seen you in many of the panels, and you are a great friend of Ukraine. We have had many times meetings in Kiev, but also you have been a Minister of Economy and Infrastructure. So I think you know how to count all the money. But also you have, being an analyst and long-term friend as well, looking at Estonia. Are there similarities how Estonia has transformed its system also over the years, and where the priorities have been if you compare to Ukraine? And also, are there any lessons that Estonia has learned since 24th of February, or any of the transformation that has been faster in the last almost 2 years? Rina.
Thank you. And luckily, this is my last panel, because if we had started with this topic, it would be very difficult to discuss the lack of nurses in the Estonian system and the sustainability of financing, because everything fails compared to the challenges that Ukraine faces during the war. But Estonia transformed its Soviet-type health system, just as Ukraine is doing now. But we didn't do it at the time of war, but what is similar, we took a direction towards Europe. We wanted a modern system, we wanted an efficient system, and I see the same model or the same thing happening in Ukraine, but even in faster pace, because you have no other option. So I definitely see similarities, but when you look at the cooperation or what has changed after the 24th of February, I would actually bring out 3 things. As Victor mentioned, that what are the most Googled aspects? Estonia has followed the same track, that we can send pharmaceuticals, mobile hospitals, we can treat Ukrainian patients who have lost their limbs, we do all that, but first we send ammunition. Because we can't solve the issue and the worries Ukraine faces through health system. Ukraine needs to win, and after that, everything is possible. So ammunition first, medical help after that, and for me, when I have visited Kiev, it has been a surprise that how much transformation can happen during war. I visited Ohmedit, the children's hospitals in Kiev, and Ukraine, at the same time as they deal with the large numbers of people who have lost their limbs, they have introduced nationwide newborn screening program. It's just unbelievable when you see it firsthand. And lastly, when it's not just only we who support Ukraine, we do that, but actually a lot has changed in Estonia. First, crisis preparedness. We have primary care centers, pharmaceuticals that have invested into generators, and also hydrogen power generators that have been built in Estonia, because hydrogen, it's less noise, less smell, better suited for medical circumstances or medical facilities. So the crisis preparedness has improved a lot, and we have learned from the Ukrainian experience. Secondly, we have been late in developing our mental health policy. And one of the issues we were figuring out how to tackle was the mental health and psychosocial support during crisis. And we had it written down. It was something we aimed to do, but we had failed to do it so far. But when we received the Ukrainian refugees, this actually forced us to make the steps we had desired to do years ago. With the help of WHO, we got technical assistance, and now we have hundreds of people who have been trained to provide mental health and psychosocial support during crisis to help the Ukrainian refugees, but also other people, Estonians, during any crisis we face. So we have done long steps in improving mental health services availability and the variety of services we are able to offer thanks to the pressure we faced when accepting the refugees. So there are positive effects of the war and crisis on Estonian health system, and also we offer a training program for Ukrainian nurses to work in the Estonian health system, not with the aim to keep them and cover our own shortage with Ukrainian nurses, but they can work in their professional field and return to provide modern health service in Ukraine after you have won. So we keep on sending ammunition and providing all type of support. Hope you can last. Yeah.
Thank you. And thank you, Rina, for reflecting and very interesting aspects also how the crises in one part of Europe actually can transform the systems in other countries, as well the similarities. Let me turn to Odeta. You're coming from Lithuania, and your minister has been visiting many times Kiev and many of the cities. And I assume there are many lessons that he has been taking with his team also back to Lithuania. But your background, you have been working for many years in the ministry. You have impressive CV. I think you have covered all the areas of healthcare possible, from nursing to the primary care, from hospitals, you name it. But also I know Lithuania has been transforming its health system at the time of COVID and at the time of now. So what are your reflections on Ukraine particularly, but also transforming the systems, and is transformation useful actually to respond to crises like COVID or any other?
Thank you for question and for introduction. We're living in a changing time. We have to live to this very strong geopolitical situation and also support strongly Ukrainian situation. But at the same time, we started to implement 6 reforms during pandemic, during migrants from Belarusian and Lithuanian borders, and also invasion of Russia in Ukraine. It was very difficult to change mind how healthcare sector have to transform and how to center our patients' needs to put in the center. And today we are implementing 6 reforms, and in all reforms we are thinking about crisis management threats, because Lithuania is around not very, our neighbors is not very friendly, but when we're talking about public health institution transform, when we talk about ambulance service centralization we took from Ukraine, we talk about implement also hospital reforms, national health insurance, national healthcare institutions network reforms included primary healthcare, health centers services and package healthcare services package in each municipality, and also hospital network. Especially we are talking about strengthening emergency services, emergency unit, ICU, trauma cluster strengthening, also capacity of our healthcare specialists. They have to know their new role, what is going around. And also we work on mental health, transforming from hospital level to community level, but also we have noticed that after pandemic, after COVID, needs of mental health is very high. Post-COVID influence our population also, and also work on long-term care issues also. A lot of changes, but the main key is that we work on a collaboration platform, establish 3 platforms of collaboration, national, regional, and in municipality level is very important. We have learned this lesson from the COVID time, that all stakeholders, all municipalities can share problems, solve and share good experiences how to solve crisis situation. And we put this collaboration key in our reform. It is quality and collaboration platform is to social innovation in our reforms context. And also we have horizontal reforms like human resources, we have just talked about that, and also digitalization. It's very important to have real data, near real data, and to admit some real decision and influence our policy making. Yeah. And what we have learned from Ukraine experiences, it is, I will say, structure, process, and outcomes. When we're talking about structure, we have changed a lot, structural reforms, and also very important international context, because we participate in your working group in Ukraine Ministry of Health. Minister is leader of this. It's called Health Working Group, and we can see all process how you reform and with related integrated of EU, and we support this. And also international activities. Next year, Lithuania will implement a rescue project, and to put our capacities to stockpile of medical equipments in Lithuania, and the EU put 100 million in that initiatives. We are responsible of that. And also is very important methodology, how to say, a competence of soft competence, how to leadership of crisis. Hospital managers, political concept, also our healthcare specialists. It's very important to share this experiences. And when we're talking about process, it's very important to go through all process, patient's pathway. Ambulance services, emergency unit, hospital, a lot of things with indicators, we work on that, and also outcomes. All today's we are talking about trust, and we have to rebuild trust of Lithuania or Europe society of needs of healthcare services, and understand of what kind of strengths we are living with this. And also transformation, and we have to do now. And finally, I would like to express Lithuanian strongly support and solidarity, and also thank you for WHO for leadership in this very, very critical health emergency issues.
Thank you. And thank you, and I think few very important aspects that we don't see preparedness and the health system separated, but actually they come very hand in hand, and much more today than ever before. But also you described so many transformations that are happening.
I can talk a lot about that.
And that's very important, because we are constantly transforming the system, whatever the environment there is. So that is, I think, very, very important to learn and share experience, as you described what you have taken from Ukraine. But I think the idea of this whole session, as well the whole conference, is also how we can transform knowledge from one country to another. And we celebrated also the birthday of Observatory, and we are having a lot of documentations around. So this is just a bit of advertisement for those who, as we said, Christmas time need extra reading. But let me come now to Isabel, who is coming from European Commission, so she can take maybe a zoom out a little bit and look more than one country and what is happening in the region. And she has long-term experience in European Commission, but also in her own country, Spain, also some years ago, looking in the work in the Ministry of Health. So how you see now what's happening in Ukraine influencing Europe, and how the European Commission has also supported.
Thank you very much, and good afternoon to everybody. So the European Commission is supporting Ukraine and the people displaced from Ukraine in the European Union also, but we are doing that in an integrated way. So supporting Ukraine is also in a selfish way, because what we want is that all the citizens of the European Union have the same level of access to healthcare, the same level of safety and quality for all the access to the healthcare and the products that are around, the medicines, blood, tissues and cells and everything. And as we hope that Ukraine will be one of the main members of the European Union, we need to support them also in having at the same level and at the same pace that all other countries of the European Union. So we have been doing not just DG Santé, where I work, but all the European Commission as such, supporting the medical evacuation that has already been named before, with the support of all the member states, 22 member states, where patients have been evacuated and then repatriated when necessary, but also for things that the minister has mentioned, the mental health support, apart from the WHO, we are doing through the International Federation of the Red Cross and also with other NGOs that are working here in the EU, but also in Ukraine, because it is one of the issues that are more necessary, and not only the patients or the person that are suffering from those problems that are obvious because of the war, but also the professionals that are working especially with children that have been quite impacted. So pediatricians, GPs, but also teachers or social workers, they are in Ukraine and here in the European Union. And many other different aspects, but even if we have been always discussing inside the European Union if there is a question of subsidiarity or not, who has to take care of the health systems in general or not. In fact, what we try, as I said, is that to offer the same conditions of all the citizens wherever they are in the European Union, and for that we not only take care of the products that are crossing the borders, but also of the people that are more and more often crossing the border just to work, to study, to travel, or because they are sick and they want to have care in another country, in another member of the Union. But also supporting all these transformations of the healthcare system in the EU member state, and we are doing that at demand when we are requested, but also showing the good experiences or the best practices that some countries can have and that can be replicated in other ones. We had a recent experience with three quite different EU countries like Belgium, Slovenia and Austria that decided to go together and to initiate some transformation in the system, one in mental health, another one in primary health care, okay, but that they were applying the same methods and that they were support not only financially but also technically, and with the European Observatory on Health System that has been mentioned, and the European Union is a member. Because sometimes I have the impression that the Union and the Commission, we are seen as the ones that do tough legislation that you need to follow, or the ones that are given money to implement that legislation. And I think that we can offer more, because we can coordinate everybody, we can coordinate everything, and we can displace the ones that know you have a good experience in digital, for example, and someone in Ukraine will need some of that experience. We can do twinning, we can organize how you can exchange that, and also because we need to listen what the member states are requesting or what they are demanding, and sometimes changing the opinion about what we plan to do, because really doesn't respond to the request of the member state, and we need to adapt. So my final issue is we are here to work for you. We are here to support you, but for that all the member states have also to work with us. And please remember that next year we have the election, and that you need to vote, because otherwise we don't know where you want that we go. So thank you.
Thank you, Isabel, and very good reflections also, how the European Commission actually can facilitate the transformation and knowledge exchange, but also the particular aspects on evacuations, but also ensuring that number of Ukrainians who have to be currently outside of Ukraine, that their care is taken care of as well. And I like what you mentioned that also about the new partners, and you mentioned Red Cross or others who are also brought in to provide the services. So I think what has happened since 24th of February, what I have seen at least, is that there are many new networks that have been established to find out how we can provide better services and how we can address actually the growing needs which are there. But one of the aspects we have learned during the COVID, as well now during the war, in particularly what's happening in Ukraine, is the importance of chronic diseases. And I would like to ask the last panelist, Adriana, who is coming from London and London School of Hygiene and Tropical Medicine, and also being associate professor there. And I know that she has been doing a lot of research lately. As WHO, we are having the meeting coming up also, which is related to the NCDs and emergencies. But what is your experience when you look to Ukraine, but also when you look to similar settings? Are we leaving people with chronic diseases behind? And is there something that we should do beyond, even more, what the minister was mentioning on mental health, rehabilitation? Do you want to put a few other ideas to the transformation agenda?
Thanks a lot, Jarno. That's a lot of pressure. Thank you for that. I was going to highlight a few examples. So of course, as you mentioned, NCDs have generally been overlooked in emergencies. A lot of our evidence for what to do in emergencies comes from what we consider sort of traditional emergencies, where health needs might have been more acute, where displaced populations were in contained areas and refugee camps. But of course, as we see more emergencies like COVID, like the war in Ukraine, affecting middle-income, higher-income countries with high burdens of NCDs, we need to know more about how we can ensure continuity of care for people with chronic conditions. So I did want to highlight 3 examples of what we've seen in the evidence. The first 2 are evidence-based. Of course, I'm a researcher, so I like the evidence-based examples, but these are evidence-based examples of ways in which responses to emergencies can, in fact, potentially be long-term health system strengthening. And then a country case example that was more of a health system strengthening initiative that actually has allowed, and this is in Turkey, has allowed the country to more nimbly or responsively react to NCD healthcare needs in an emergency. And these are coming from a review that I'm working on with WHO Euro on NCDs, but I think are more widely applicable than just to chronic conditions. So the first one I wanted to focus on was teleconsultations and COVID. And of course, it's no surprise that teleconsultations increased significantly. The WHO Observatory did a very nice review of variations across countries. We've heard about it even in Ukraine. 39 countries during COVID implemented remote consultations. And for example, in Lithuania, I think Odeta can correct me if I'm wrong, but the numbers are something like from April 2019, there were maybe 11,000 teleconsultations, and that number increased to 758,000 a year later. So there's a lot of experience. The issue is that not a lot of countries have evaluated how that has impacted on outcomes and on access to care. A few countries have: Ireland, Italy, Portugal, the UK, and Germany. And I'll just highlight, in the UK, for example, they evaluated the difference between remote and teleconsultations for hypertension management and found that there was no difference in errors in terms of blood pressure readings. In Germany, there was a randomized control trial, a sort of gold standard of research, comparing online blood pressure monitoring with online transmission of blood pressure measurements and a chat function, and found that over 6 to 12 months, blood pressure control actually improved. And perhaps, definitely as importantly, but maybe more relevant for our session today, we just talked about investing better in health in the last plenary. These were also found to be cost-saving initiatives and relevant to trust and transformation. Very importantly, patients liked them. Generally speaking, patient satisfaction was high. So this is a potential longer-term health system strengthening approach. Of course, there are questions. Access to technology is not always equal across populations. Internet literacy, what are the longer-term outcomes? So questions do remain. The other one I wanted to focus on is more macro, and it's around entitlements to healthcare. And of course, Europe now has a lot of experience with this, first with Syrian refugees, and now, of course, with refugees from Ukraine. I'm sure Isabel could talk in more depth about this, but the Barcelona office also of health systems financing has reviewed various different measures and investments that different countries have made to provide entitlements to Ukrainian refugees, from Bulgaria and Czechia, where the government made contributions to health insurance on behalf of refugees, Poland, Sweden, Finland, Norway, who give allowances or cash transfers to refugees on arrival for subsistence needs, including healthcare. Of course, from all of these, the question is always, how sustainable is that? And often the arguments are moral, but there is in fact economic evidence that I wanted to highlight. So Keivan Bozsogmer, who you may have come across as a colleague from University of Bielefeld, actually compared and had an opportunity to compare a period of time in Germany where policies changed, where they went from restricting access to refugees and asylum seekers in the beginning on arrival because they wanted to dissuade refugees or asylum seekers from just coming to get free health care, or they thought they would dissuade them. So they restricted access or delayed it, and over time that policy changed, and they were able to compare. And even controlling for need and various other confounding factors, over time, giving immediate access to healthcare entitlements meant that healthcare outcomes improved and healthcare costs came down. And not just for people paying out of pocket, but for the system in general. And that was because people were seeking care earlier, and they were seeking care in primary healthcare, at the primary healthcare level, rather than waiting until they had more acute needs that are much more costly. And finally, an example from Turkey that hasn't been formally evaluated, but I think is a really nice example of the reverse, where a healthcare strengthening initiative allowed the country to be more responsive in a crisis. So in Turkey in 2015, if there's anybody from Turkey here, please correct me if I get any details wrong, but in 2015 they implemented an electronic healthcare record system called e-Nabis. It's a mobile app that's linked to all health facilities. They feed information into it for every test, every diagnosis, every medication. So it's certainly much better than the NHS app in the UK from my personal experience. And everybody can have it on their mobile phone. And at the last time I checked, over 80% of the population had registered for this app. And it was, lauded as something that could help with pandemics. What they didn't anticipate and what ended up happening is in 2023, when the earthquake hit, it allowed the Turkish government to very, very quickly identify all people with non-communicable diseases who needed urgent care, who were in the earthquake zone. And that allowed them to respond quickly and evacuate those people. It also allowed them to plan for what kinds of drugs and supplies would be required in different areas. And also importantly, for all kinds of emergencies, everybody who was displaced from their place of home was able to have their record on their phone, both within and outside the country. So I've highlighted those three examples, but what I would say is that actually there weren't very many to choose from, because there are lots of examples of countries doing things, and we've heard some of them today, but not a lot of this is documented. And so as a researcher, my plea is that more of that be documented and evaluated in rapid, practical ways, not with 5-year-long projects. In Ukraine, I'll just bring it back to that, we have two very good examples around primary care strengthening that's allowed the country to respond, the mobile healthcare units, and I've seen from the postcards that you've distributed, those have been shared, so I'm looking forward to reading those and incorporating them in our review of evidence.
Thank you. And it was really great to see, actually, and these examples, what you brought also, that some of the transformation actually helps us to respond to the future emergencies, and then other colleagues also mentioned how we actually, emergency preparedness becomes more and more important in the health system. I heard also you mentioned digital, you mentioned information, you mentioned primary care. There are many of the elements I think we have been discussing over these 2 days. I had to stand up because there is a very strong light, so I barely see any of you in the room. But if any of you have a question That's now the chance. Before, I know Minister needs to be back in Kiev, where we need to be almost tomorrow evening. Some colleagues in other places in Europe or other cities. But now it's a chance to ask questions from the panelists or you reflect yourself. I think we have 7 minutes, so I'm happy to take 3 questions if I see any hands going up. Or you are so tired after 2 days of listening? Yes, I see one hand.
Hi, it's Gordon Gallia, Strategic Advisor on Non-Communicable Diseases and Innovation at WHO Europe, collaborating with Adriana on the review, but also closely collaborating with all the member states, but very particularly my team with Minister Lyashko's team in Ukraine. I remember very clearly when you came, Minister Lyashko, that you referred to one of the statistics in the slide that you did not discuss in detail, in which you were showing that people in Ukraine have had neglect from non-communicable disease prevention and treatment because of the lockdown in COVID, and then because of the conflict, and no one is going to go for a vaccination when they're at risk of being hit by a missile. And so this worry that over a period of time, Ukraine is going to face a wave of late-stage NCDs, the cancers that could have been caught by screening, or the strokes that could have been prevented by hypertension treatment earlier. So there's complex emergencies actually relate and interact with each other, and interact as well with the underlying issues. Men already had 12 years of life expectancy below women in Ukraine, even before the 24th of February of 2022. So the greater risk of NCD, the problem of pandemic interacting. But I have also to reflect in terms of our collaboration on a theme that has not been discussed today, on how much importance you are giving to prevention within this transformation. Ukraine, it's not well known, is one of the leaders in Europe in terms of how close the alcohol progress is in terms of reaching the targets for the global monitoring framework and the non-communicable disease global targets, and it will be one of the stars at the UN high-level meeting in 2025. While I have the floor, so this is an appreciation of our collaboration, school nutrition, procurement of food. These are not the types of things one relates almost to questions when one talks about 7 million refugees, but the fundamental attention also to the prevention side, I think, is one important first point. A second is a little plug for our more regional work. We've had a consultation on NCDs and emergencies. We're putting together a preparedness 2.0 draft document for the regional committee approval in October next year. And in the preparation of that, an NCD working group is being put together, trying to make all these elements of response to emergency in transformation of health systems a very important part of country preparedness, response, and recovery. One final plug is that, thank you for allowing me the time. One final plug, 27th through the 29th of February of next year, we will be having a global conference, hosting it in Copenhagen, on non-communicable diseases and emergencies, where these issues will be amplified and discussed in detail. We're looking forward to seeing both ministers there and all the member states joining. Thank you very much.
Thank you. And I think these were more kind of comments and additions, what to be ready. And also, I think you were inspired by Adriana's points as well, the minister, on the prevention. I will, maybe if the minister wants to address it at the end, I leave the floor. There was another hand, I think, on the other side. Yes, please.
Thank you. Birgit Lau from Estonian Health Board. The word of preparedness came on our table because of the pandemics and also for the civil side of medicine because of the war in Ukraine. Some of us dedicated the last week for War and Catastrophe Medicine Conference in Estonia, and we heard a lot about from military side of the medical demand on a civil side. I think this is the time and the place to ask if we could prepare again. What are the three main topics from the military medicine side that we should take on board for civil medicine? Thank you.
Thank you. I think that's a second good question for the minister, what to learn. And I know from minister that he said that 24th of February was a very, let's say, significant day, not to go to the details, but one thing that helped was all the coordination at the COVID time. But probably there are many other examples. So that's a second question to the minister. Any third question? No other questions, and I will leave it to Victor to reflect, and if any of the panelists would like to have 2 words, but I know that the main hall is also waiting us back. Victor.
Дякую. Якщо говорити про неінфекційні захворювання під час війни, то це ми можемо ще на годину часу, як мінімум, зависнути в дискусіях. Ми розуміємо величезні проблеми з раннім виявленням, зі скринінгом, розуміємо, як молодшають інфаркти, інсульти, на яких стадіях виявляються сьогодні онкологічні хвороби. І ми до цього вже готуємо систему охорони здоров'я, розуміючи, що випадки будуть складніші, економічніше, дороговартісніші. До цього треба готуватись, і ми до цього готуємося. Але ми недавно проводили конференцію спільно з ВОЗом, де говорили і про профілактику неінфекційних захворювань, і про збільшення поведінкових факторів ризику через те, що стресова ситуація вплив, і часто той же алкоголь, наркотичні речовини, табак є як один із антистресових засобів для людей, які не розуміють всіх проблематик наслідків цього питання. Щодо 3 порад з точки зору воєнної медицини, по-перше, що я хочу всім сказати, до війни неможливо підготуватись. Як би ви не думали, що система охорони здоров'я готова реагувати на виклики, це буде самообман. Ми повинні готуватись, ми повинні бути готовими, але ми не зможемо зрозуміти, як поведе себе будь-хто в ситуації, коли твоє життя стає під загрозою. І повірте, я вдячний нашим медичним працівникам, які 24 лютого, незважаючи на те, чи було в тебе чергування, чи не було те чергування, пішли на свої робочі місця в лікарні. Так багато хто, як ми чули на ефірі, поїхав з лікарні, але це ті лікарні, які потенційно попадали в окупацію. Але бригади швидкої медичної допомоги працювали в надрежимі. Хірурги були в операційних, медсестри були в операційних. У нас випадки були в країні, коли російський літак скинув бомбу на житловий квартал міста Чернігова. Одночасно в черзі до приймального відділення в лікарні стояло 52 швидких автомобілі швидкої медичної допомоги. 52. Санітарне сортування розпочиналось пересуванням швидких автомобілів. хірурги не встигали. Переливання крові і компонентів відбувалося в автомобілях швидкої медичної допомоги. І коли ми говоримо про 3 поради, моя порада – відпрацьовувати навички кризового реагування в кожному конкретному закладі. Відключайте просто світло. Не думайте, що відключене світло і як воно у вас буде працювати, а просто відключіть. І ви побачите, що те, що написано в алгоритмах, не так буде працювати насправді. І коли побачимо, як воно працює насправді, зовсім інакше ми готуємось до систем. Спочатку всі хочуть один генератор великої потужності, який автоматично перезаключить і буде працювати вся лікарня. Через 1,5 року війни всі хочуть маленькі генератори, щоб забезпечити роботу конкретного відділення, бо розуміють наслідки перебоїв мережі, перебої ліфтових шахтів, там величезна кількість різних речей. Тому навчання при реагуванні – це ключова задача, як повинно все працювати. І плюс окреме питання – відпрацьовуйте етапи евакуації. Якщо ось тут сталося, куди веземо, хто приймає і хто везе. І спробуйте перевести пацієнта на апараті штучної вентиляції легень, спочатку 1, а потім 10 в той же ж самий конкретний момент часу. І ви побачите, що такої кількості бригад, які можуть це забезпечити, знову ж таки не вистачає. І як з цим працювати – це окреме питання. Окреме питання – наявність хірургічного інструментарію для того, щоб лікарня працювала 24/7 хоча б 2-3 дні. Бо запустити його в стерилізаційну і повернути назад нереалістично. З тої кількості обладнання, яке для мирного часу предназначено. Тому про виклики військового часу і те, як треба, що ми для себе винесли, які уроки, ми, думаю, що організуємо конференцію в Україні, коли у нас буде більш безпечніше, ми будемо ділитися цим досвідом. Але повірте, ми зараз, воюючи, готуємося до застосування хімічної зброї. Ми готуємося до застосування ядерної зброї або радіаційних аварій. І не просто так готуємося, бо ми розуміємо, хто на нас напав. Дякую.
Thank you. And I really like to thank Victor, Verena, Odetta, Isabella, and Adriana. Thank you, and from all of us. And thank you for all of you for coming. I know that I'm a terrible timekeeper, so we are probably 5 minutes late somewhere where we need to go. I know that for the panel, we need to do a one group picture, otherwise I get a note from Natasha and organizers. But thank you for coming, and you know from where to find us, because we talk about Ukraine in Ukraine. So welcome to Kiev.